Welcome to Heber Valley Life podcast. I'm your host, Rachel Kaler, and today we are diving into a topic that touches every single one of us in this valley, and that's healthcare. And Intermountain Health is celebrating 50 years in 2025, and today we're joined by someone who knows our community hospital in and out, especially when it comes to women's health. Please welcome Amy Tuddenham, a friend of mine, and I'm so excited to have you here on the podcast. Let's talk about, tell us about yourself. Tell the listeners a little bit about yourself, your role at the hospital, a little bit about your family, and what motivates you.
Well, thanks for having me on, Rachel. I appreciate you inviting me, and I do appreciate your friendship over the years. We first got to know each other on
The chamber.
well, actually, I think it was before then on the J.R. Smith School Council.
Oh, yes.
That was my first meeting with you.
Moms that can make a difference.
Yeah, moms working for a better education for their kids.
Yeah.
It's kind of a fun path of knowing you. I'm the communications director for Heber Valley Hospital. And actually, a couple of years ago, I added Park City Hospital into my portfolio. But I've been in healthcare since 1994. So various roles.
Full career.
Full career. I've only known healthcare, internships in healthcare. And then when we moved to the Valley in 2000, I needed to know what healthcare options we had. I had a young family, so I went and set up some appointments with some physicians and interviewed them, kind of an interview to see if I really wanted to change my healthcare from the Wasatch Front to back here. And some physicians, yes, I was spot on. We had great family practice providers, a great pediatrician in the community. And I had never intended to go back to work. And then just through those natural visits as a patient with the healthcare community, Randy Probst reached out and hired me a couple of years later. So
Great.
I've been involved. We've had 4 children. We now have 4 grandchildren into the family mix, and it's wonderful. All that they say about having grandkids is true.
So your role as communications director with both Park City and Heber, I mean, you're really responsible for the messaging, the public relations, but you're also involved in a lot of the day-to-day administration rules.
Yes. So I sit on the admin council at both hospitals. And so that includes looking at what operations are happening, looking at the strategies and growth that we're experiencing in the community, um, serving as administrator on call in the event something happens, you get called in. And I love it. It's chaotic. And some days I think that it's exhausting, but I definitely am. I'm definitely where I need to be.
I love that. And you really are, you really care about it, which I love. Let's talk about the hospital. And it's interesting. I don't think everyone is aware that we've had 3 different hospitals in this valley. We started out with the original hospital that is on 100 South. It was a donation from Mark Jeffs. Now it's the Heber Thrift Store. Then the hospital moved up to 500 East on Center Street, which is now the health department. And then in 1999, the construction began on our current hospital. And it's been impressive to see that hospital change over the years to meet the needs of the community. Can you walk me through a little bit about that hospital now and the iterations that have happened since 2023 when you really went through a massive $43 million remodel?
Well, I think that noticing that the hospital, we've always had some form of healthcare here in the Valley. And so we have a lot of history to build on, a lot of caregivers who love this community and they love the opportunity to serve and care for others. One thing that we've really noticed, or one thing that we've really tried to do over the years, is make sure that we're growing to match the needs of the community. Obviously, in 1999, the hospital at the current location opened in October of 1999. And we really were based on a rural healthcare model, which is family practice providers offering the full depth and breadth of services, from family practice to delivering babies, from to surgery to emergency care. And we had a phenomenal family practice group that was doing that. And then as the community started to grow, we would look at the data and the numbers, and we could see that we needed to switch the model. We needed to become a more specialized facility because of the growth of the community. And so since probably 2008, I want to say, is about when we really started to strategically look at what are the needs of our community and what are the future needs of our community. And then we started to bring in those services that people were looking for. In healthcare, we look at the data around around where people are going for the healthcare. And of course, we don't have patient names tied to anything, but we can see that this many percentage of our community is leaving for OB care, or this many are leaving for ENT services or orthopedic services. And so as we look at that data, then we determine what services do we need to bring close to home? And then we want to ensure that we can always bring that with the highest level of quality. And so that's how we started to build the services. Okay, we need board certified emergency room physicians. And that was probably the first transition we made. Looking at the acuity. So kind of a better way to say, look at the I'm trying to figure out how to explain acuity. Looking at what services people are coming into the emergency room for. We first then started to build that. Can I start that completely over? Okay, sorry. That was a quick one. Okay. So we first started to look at what do we need to change in this model to bring more specialized healthcare close to home. And that was first bringing in emergency room, board certified emergency room physicians. So we looked at what people
what needs were. I mean,
Yeah, what
who's
the
coming
needs
in for
were.
emergency services? Who's coming in for labor and delivery? You know, I feel like the ER, especially in this valley, because of where we're located, because of proximity to the Strawberry Reservoir, because of the search and rescue, because of all the tourists and the people that are coming to recreate and then get themselves in trouble, the hospital really became an urgent need hospital, not because of the existing community, but because of the people that were coming to recreate.
Thank you. Thank you for putting my thoughts into some clarity there. But yes, but we also decided that we needed a higher level. We need to be able to offer a higher level of care
Yeah.
to our community partners and to the residents. I remember when I moved here, people were like, you'd go to that hospital and they would just kind of put a band-aid on you and get you where you needed to be.
Right.
Well, that's no longer the case.
It was the triage hospital to get you to the bigger cities.
Yes.
Yeah.
And there's still, I want to clarify that there's still a lot of collaboration between our facility and, say, a trauma level 1 center.
Right.
Just because there are only so many services that we can bring here
Right.
appropriately. And I think Claire Provost was on your podcast a couple of weeks ago, and he mentioned that we look at what we're going to bring into the community, and we want to make sure that, one, we do it at the highest level of quality that we can, and that it's appropriate for the size of hospital that we have. So we will probably never have a cath lab here at Heber, at least in my lifetime.
Right.
But if you are experiencing a heart attack, you go to the nearest facility. We give you the proper medications. We stabilize you, and then we put you on life flight. You bypass any emergency room stop at Utah Valley or IMED, and you go directly into the cath lab.
Right.
So you already have those services. It's, I think a 7-minute flight to IMED. So
But you're stabilized.
So
You're not
you're
there
stabilized.
driving down the canyon and speeding, running into traffic, all of that. And there's several examples of that, of people in the community that had the decision, do I go left or right? They came to the hospital, they were stabilized, and it saved their lives.
Exactly. And as you talk about that, I had one patient that called me one day, and she actually gave me permission to tell her story, but she had that very decision. She knew she was having a heart attack. And she was like, if I went right, I was going to go to Heber Valley Hospital. If I went left, I knew I was going to drive down the canyon. And it ended up that she got into the emergency department. And I remember her and Dr. Kemp were telling me the story, and she coded. And had she gone down the canyon,
It would have been in the middle of the canyon.
it would have been in the middle of the canyon. And what she had said to me, she said, Amy, my husband probably would have pulled over and just held me while I died, because it was late at night. And what would he have done? Called an ambulance. At that point, it would have taken 15, 20 minutes. And by then she would have passed away. So there still will be opportunities or situations where you have to be transferred to a higher level of care.
Right.
But I can fully get behind the care that we offer at this facility in stabilizing you, providing that care for you, and ensuring that we either take care of you here and get you whole, or you have a flight into the facility where you need to be.
What amazed me so I've been through the hospital several times on tours as they've expanded and such, 19 beds. It's not a big hospital, and yet the services that are now offered are really astounding. I want to read kind of a timeline
Okay.
that has happened over the last couple of years. So the original hospital that was started in 1993 was 43,000 square feet. It's now 68,000 square feet. It's now an award-winning critical access hospital, full medical campus, 21 specialties, nearly 70 providers, which is always growing and changing. But just for a timeline, just to understand, from 1999, I think there was a little lull as the community stabilized, but then we obviously have gone through this growth projection. And the hospital has stepped up to meet that growth. 2011, Women's Imaging Center expanded to include digital mammography and DEXA scan bone density testing. We'll get to that. 2012, the first Ladies' Night Out was held. We'll get to that. 2013, the first $1 million raised to bring the dialysis center to the Wasatch Back. 2014, the opening of the Heber Valley Dialysis Center, plus the new physical therapy services. 2015, level 5 trauma designation. 2020, $43 million hospital campus expansion and upgrade completely. 2023, renovation and redesign of the hospital laboratory. 2024, triple the size of the specialty clinic.
Yes. It's been a busy, busy,
Easy.
what did you say in there?
14
14 years?
Yeah.
Yeah. Some days that's why I think I'm tired.
So let's go back to 2011, digital mammography and the DEXA scan bone density testing. I look back at that having grown up here and thought, okay, so any woman that needed to do a mammogram had to drive somewhere.
Well, you didn't have to leave the valley, but we did not have digital mammography at the time. And also, it was very disconnected. So you go in, and I'll tell a patient story from my experience. I went in and had to have some imaging done. I was expecting, and I changed in one area of the hospital into my gown for imaging. And then I had to walk across the main lobby and down the hallway in a gown that has the back open into this room.
Hold
to have
everything together.
Yes, and so it was I remember it was Dixie Hess, who was the imaging tech that took care of me that day, and she was phenomenal. But even she was like, "Okay, Amy, this is gonna be a little uncomfortable. We're gonna walk this path." And so in 2011, we brought everything into one area of the hospital because it really is about a patient experience.
Yeah.
And we have phenomenal caregivers that do a good job, but we have to walk with an open gown through a public hallway. It's embarrassing. And so we had moved everything to that women's imaging center. So now you check in at the lobby and then imaging takes you back down one hallway
And it's right there.
and it's right there. Everything is right there, whether you have to change, but you have all of your CT, your imaging, your MRI, your DEXA, and your mammography all in one area.
And those women do a fantastic job.
They really
Stay
do.
very comfortable. October is breast cancer awareness. Yes. And so you get the cute little pink bags. But I really do feel like that investment has changed the availability and the comfort level. And I'm sure you're seeing more women that are coming in because they get to see people that they enjoy seeing. It's no longer a chore, but and I look forward to it. I mean, May and Courtney really have created an environment that is comfortable for women in a very uncomfortable situation.
Yes, I agree with you. They do an incredible job. Last year we did just over 3,700 mammograms, and we are on track to exceed that this year. And the imaging team often talks about what do we do to increase access for women because we know that prevention is the best detection. And I know that's kind of a trite phrase that everyone uses, but really, if you can catch any kind of illness or cancer before it's in those later stages, your likelihood of recovering, of having a full vital life are so much better if waiting. So we really do encourage people to get their imaging, their mammograms, annually. I believe it's starting at 40 and then annually, and then stay on track to do that because if we can detect it early, your outcomes are so much better. And the team does a great job of making you feel comfortable and helping you through that, especially for some, it's an uncomfortable situation. And it can be frightening, especially if you've had breast cancer in the past or if you have a family history of it.
Yeah. And they're really good about just making it feel it's okay. Let's just talk. It's like seeing an old friend. So I appreciate those women. Let's transition then to maternity care.
Okay.
Um, over the years, a lot of people were leaving the valley to have babies, but that has changed. And I feel like there have been specific doctors that have really created an environment of listening to women, a nursing staff that takes such good care while you're in the birthing center. But talk to us about how that has changed over the last couple of years.
Well, that is delivering a baby is one of the most beautiful times in life, and I'm so grateful that we've got 3 providers that deliver and then 1 provider that, is a nurse practitioner that works in that practice, and I know we were gonna stay away from physicians' names, but I'm just gonna list that we've got Dr. Cook,
Mhm.
Dr. Longnecker, Dr. Katie Shepherd, who's new to the practice this year and phenomenal. I have loved my interactions with her, and then we have Jax Knight, who is doing, she's a nurse practitioner with their group, and that those 4 provide, the kind of the OB/GYN care. You can still see your family practice physician, for that care, but that's our delivering group, and the care is phenomenal. Um, it's always so fun to me when I get messages on Facebook or someone stops me in the grocery store or I get a phone call from one of their patients, and they just tell me about the care that they receive from those doctors. They tell me about how loved they feel by those physicians, how much those doctors truly want to to be part of this really sacred experience. And I, I usually go back and call the physicians or send them a note, and they blush. They're just these really incredible
Love
people.
to hear what they do.
They love what they do.
Mhm.
I remember a couple of years ago on Facebook, a patient had put that if she didn't love her husband so much, she would chase Dr. Cook. And it was just the cutest story. I called her. She had such a good experience. Yeah. She's like, he was just the kindest, most compassionate physician during the whole delivery process. And he really cared about me and my family. And I think that resonates throughout the whole hospital. That's one thing that we get a lot on our patient scores and feedback is there's something special about this place and the care that your team provided for me. And it's fun to listen to those stories.
Do you know how many babies are born?
We delivered 260 babies last year. And to be honest, I didn't pull data.
Almost every other day, though.
Yeah, I didn't pull data for what
Mhm.
we're on track for this year.
So fun. So, do they still do the chime?
Yes.
Oh, I love that. Okay, so let's move to gynecology,
Okay.
just in general, women's health. So, you and I are past baby stage. And what is there available for women in their 40s, 50s, 60s, 70s that will help them, go into the aging process?
Okay, so that's a great question, and one that, I mean, eight- 80% of healthcare decisions are driven by women. So not only do we need to look at what we're doing to take care of ourselves, but then we need to know what's going on around us and what's available to help our families. Um, so most of our family practice physicians still will treat you in
Mhm.
those GYN years,
Yeah.
plus then Cook, Longnecker, Jax. We have Jill Fotts,
Right.
Katie Shepherd. All of those physicians do really look at the GYN years. I know, and then there's some discussion about hormone replacement therapy,
Right.
and this is a personal opinion. I think that needs to be a discussion with you and your physician.
For sure.
I know there's so many influencers that are saying you need to do A, B, C, and then everything is solved. I think it's individual
Mhm.
for each woman, but I think that needs to be a discussion with her physician. And since I'm in that stage right now, I am working with my physician on what's appropriate for me in that hormone replacement therapy in these 50 plus years that I need to be doing to maintain my health. And the thing that I love about my provider that's here in the valley, um, I know it's unique to me because as she's treating some of my other friends, what she's telling us isn't always the same.
Interesting.
I get, for someone that's worked in healthcare for my entire career, I get a little frustrated when it's like a cookie cutter approach.
Yeah.
You need to do ABC and you need to do this and this person needs to do this. So I've been really impressed with my physician that what she's telling me is a little bit different than what she's telling my girlfriend because she's looking at our blood work, she's looking at our lifestyle, and she's helping guide that. Um, and that's something that I'm coming to realize is really important, that healthcare is individual to me. And so I think that just needs to be a conversation with your physician. And I know as I worked with all of our physicians here, if they, like, if at one point they were like, you need to see a specialist and we're going to send you to this clinic in Utah County because we didn't have that service up here. And it was just for a short time where I got to work with a different physician on some health issues I was having. And then I transitioned back into my physician.
Wow.
And so I think that's important.
Let's talk about the specialty clinic because it's new to me. I did not even realize it until I went in for something and said, wait, dermatology's here as well, and was able to get in within 2 weeks. And so the different options within the specialty clinic, I was so impressed with. So the expansion last year, you now have the ENTs, which you had before, sleep medicine, gastroenterology, urology, dermatology, and pain management.
Yes. And we also have general surgery in that suite.
And then I also saw that cardiologist was something that you were hoping to bring onto the hospital last year, and have you been able to find a provider for that?
Yes, we have. So we've got 3 providers that rotate through. And one thing about the specialty clinic is that we have a lot of providers that go back and forth between Heber and Park City. And I'm just going to back up. When we opened Park City Hospital in 2009, I had several community members call me saying, that hospital is going to destroy this community hospital. And we weren't sure what was going to happen. But what I've seen is that having a larger patient population, we can bring in a higher level of specialty care, and they can go back and forth between 2 hospitals and they can build their practice on
Yeah,
that.
the providers.
Yes.
They're willing to come to Heber as well as serve Park City. So it's not just we're serving the Park City community. They're actually working in conjunction with both communities.
Yes. Well, and really a provider. So when I was first hired, one of the challenges we had, and I just want to back up and give you a little bit of context of why this structure of Park City and Heber Valley hospitals together works so well. A general surgeon, I'm thinking of a specific general surgeon that came to the community twice a week or twice a month, and then did surgery twice a month in the community. As his practice grew outside of the Wasatch back, it got too challenging for him to keep his surgery days up here. And so he built a patient base in the community. He built a referral base with our physicians, but then it got too hard for him to do surgeries here. So he would say, I'll come see you once a month, but then you need to come down to my hospital for surgery. So now that we've got Park City Hospital, those physicians can go back and forth between Heber and Park City. So they have clinic days between Heber and Park City, and then they have surgery days at the hospitals, and they have a broader patient base to look at. And so I know that Claire mentioned we brought the Wasatch Back boards together,
Right.
because strategically the Wasatch Back is a better population for us to look at about how we can serve together. And then that's why we decide we're going to do dialysis in Heber, we're going to do an ICU in Park City. And so we look at what's appropriate at each hospital, and then we have all of the Wasatch Back population to base our growth strategies on.
And bring those specialists. But now you're serving both communities.
Yes.
This one individual that has that specialty has spent 10 years in school, 12 years in school, really honed their skills, and now we're getting the benefit of both.
Yes, and it's a lifestyle that they can live with. It's really challenging to have an office in Heber and an office in Tooele.
Yeah.
Serving 2 small communities. You can have an office in Heber and Park City. You still have the quality of life that you're looking for. You live in a beautiful area, and you can build your practice on that.
Mhm.
And so most of our physicians go back and forth. We do have cardiology. Great cardiologists. Actually, my parents are coming up from Salt Lake to have their cardiology care up here. And then we've added oncology this year. So we added chemotherapy in 2020 when we finished the expansion of the hospital. And then we just recently hired some oncologists. So we have 3 oncologists that go around the Wasatch Back. We've got 2 based here at Heber. And then they're part of the Intermountain Cancer Care system
And stroke. We're going to also treat the stroke with the telehealth.
And we do have a lot of telehealth services. I have a sheet because there's so many telehealth services that we do offer.
Yeah.
And the one good thing from COVID was that telehealth services were not actually covered under insurance. we've been working on that as a system for several years before COVID, but really when COVID hit, that telehealth component really got approved through insurances, and it really took
Our life brings it to the next level.
it really does.
You have your primary provider here. He can tap into a specialist, get information from a specialist, and then treat you in your home hospital.
Oh, completely. Um, we have we have a really healthy family. But I will tell you that last year I had a grandson that was injured, and my daughter called and said, "What do I do?" I said, "Get him to the nearest hospital." And they live across the street from Heber. And within minutes, we were dialed into Primary Children's Hospital, and that primary children's critical care physician was working with the team here at Heber Valley Hospital. And when they finally got my grandson to Primary Children's, they had said that team at Heber saved his life.
Amazing. Yeah. And he's doing great. He's thriving.
Oh, he's thriving.
Still has things to work through, but
A couple things.
Yeah.
Really, he's a okay, lighter 5-year-old.
yes, he is.
But that telehealth service is so key to, I know that a big discussion around telehealth is, well, I want a NICU. I want to have a NICU when I deliver my baby. There's really such a small percentage of moms and babies that need a NICU. Um, you can deliver here in your home community. And then if that need arises, you have the neonatologist that comes in on that TV
Yeah.
and is right there with the care, directing all of the care for that baby while they're determining if that baby really needs a NICU or if there's some things that we can do here to keep you and your baby together in the room. It's really a phenomenal service, and it's fascinating for me to see that this is where we are with that telehealth component.
And it's encouraging to see that technology is being used for good.
Oh yeah.
Yeah, so great. I want to transition to the dialysis center.
Okay.
I know that was a big part of your job several years ago, the fundraising. I know that first million was such a kind of a landmark. Okay, we got this. We can make this happen. Pat Moran was really the reason why the dialysis center is what it is now because of her generous donation
Yes.
and also individuals in this community that were willing to give $100, 200, thousands of dollars. But it really, I don't think people that aren't involved with dialysis understand the impact that dialysis would has on an individual. And just recently, I've had the opportunity to have a new neighbor that has moved in that is using High Valley Transit to come to the dialysis center 3 times a week. She is on dialysis, and she just shared with me two things: how much she loves living here. She raised her family in Nebraska, came out here following children and needed a dialysis center. She knew that she was going to need that and the opportunity to live in this valley and have the services that she needs and having the public transportation to get her there 3 times a week. But, these people become her family because she's there so often. And it was really heartwarming for me knowing what you went through to raise that money, to hear somebody's experience of going through that now.
Yeah. Oh, that dialysis center is so dear to my heart. I got to know so many phenomenal people in this valley. Bert and Donna Giles had actually come to me with DJ Wright and said, "We will give you a gift of money if you can help us build a dialysis center." And of course, we want to be really strategic. And it was hard for me to say, yes, we're going to do this, but I have to be strategic about it because it has to be able to be what the community needs, and then it has to be able to operate. I didn't want to bring, we couldn't, as Intermountain Health, we couldn't bring a service that was going to fail or that wasn't what was needed. But so I got to spend a lot of time doing research and getting to know the people in the community who needed dialysis. And I'd go into their homes and I'd interview them. I'd look at their situations about how often they were, you're right, they go down the canyon 3 days a week, and dialysis is a 4 or 5 hour procedure. Plus, then if you look at a 45 to 60-minute commute, depending on where you're going, it took their entire day. I mean, these people are so dear to me. And when I think back on that, that was a tremendous time in my life and my career. We had a great committee, Robert Hicken and Paul Weller and BJ Wright and the Moultons and the Giles. It was just a great team as we pulled that together. And I was remembering that Glenna Moulton was one of the patients that had volunteered to be on the fundraising committee, volunteered to be the voice of the fundraising committee. And she passed away in December before we opened the dialysis center. And I remember just sitting down and crying and kind of feeling like I had failed her because she wanted this service close to home and we weren't quite open yet. So it was a little heartbreaking. Her husband,
So hoped you don't get to see
yeah,
the fruit of your labor.
yeah. But it's such a great opportunity for me. I go in now and it feels like one of my little children, that dialysis center. We had a lot of support from Pat Moran, like you had mentioned. Um, and it was I'm not a fundraiser, but I was tasked to do this job. And I went into her house and she just greeted me with a hug and she kind of just calmed my fears because I was shaking as I'm holding this portfolio document, ask for a $500,000. And she just gave me this sweet little hug and was so, even still to this day when I run into her, she's just building confidence. She's just trying,
She's so genuine.
she's so genuine and kind. And then we also had the Sorensen Legacy Foundation, Tune and Joan Fenton, that contributed. And then we had a lot of support from the community and the committee as a whole. And I remember when we were in that committee, our planning meetings, we wanted to make sure that Glenna and Donna's grandchildren can even give. So we did a program at the school district where kids could paint tiles. And I remember taking everything into the schools and they got to paint their tiles. And then BJ Wright took them home and had them fired. And now we have artwork hanging in the dialysis center of all of these kids' art that it's just a tender place to be, you know? So,
Yeah, I went by the wall and took a picture because I thought it was a hard couple of years to raise that money.
that it, I think what was harder was getting all the data to ensure that we could operate.
Yeah,
That was the high freight project.
right.
It really only took us 10 months to raise the money. So impressive, just under $1 million. But the hard part was going into those homes, knowing that some of those patients, I remember one patient saying to me, Amy, both her and her husband were on dialysis. And she said, you know, one day we will make the decision to stop going down the canyon. And then it's just a matter of days before they pass away. And I remember walking out of that house and climbing in my car and sitting down and crying because I'm like, I don't realize how good of help I have. And these people are sometimes when you have chronic illnesses, you struggle with other financial issues and it's just hard to live. And that dialysis project taught me that health is everything and that what can I do or what can we as Intermountain Health and this community hospital do to improve health for those in this community? Because that cute husband and wife that said one day they're just going to make the decision to stop going down was devastating for me to think that you make that decision to not show up for your dialysis like it's a matter of days.
I knew this was going to get emotional. Sorry, it is. No, I love it. Let's talk about happier things. Girls' Night Out. You've been championing this for many years. We talked about it started in 2012. You've had some amazing guest speakers.
Yes.
Noelle Picus
Pace came last year.
Pace. Anne Romney is one of your favorites. Why do you put so much effort into this event? And I know it's some women forget about it, but the women that come just feel nurtured and uplifted. And every year, it's just been such an amazing opportunity for the women in our community to come together, to hug, to share, and to realize how important our health is.
Well, and I think you summarized it perfectly why I do it. I think, and I had mentioned that women, we decide 80% of the healthcare for our families. So we need to know what's going on and what's available to us so that we can help guide that path. My husband is a wonderful, wonderful guy, but for years, he never went to the doctor. He never looked at things or was that proactive element of our health, which I think is so important. And so as a woman, I think we need to ask questions. I think we need to make sure we know what options are available. Um, and we need to really talk with our provider about what we want. I know that in labor and delivery, you can do a birth plan now. That was not an option when, that wasn't a lingo when you and I were delivering babies, but you can really sit down with your provider and you can say, this is what I want my delivery experience to look like, A, B, C, D. And you can kind of work work on that with your provider, with your nursing team when you get into the hospital. And I don't think women realize that we can really dig in and guide the kind of help that our families need. And so that's why we put Ladies' Night out together, because I think it's important for us to celebrate the strength that we have and all that we bring to our families and our communities and our volunteers opportunities and our friendships.
Yeah.
And that's what this is supposed to be, as well as then raise awareness about what services are here. When I moved here in 2000, you had your great family practice doctors, but that was really it. You had to leave for a lot of healthcare. And now there's so much that you can stay close to home for.
And I feel like it's important for women to share the knowledge that they have, the experiences they've had, because so often people go out on social media and they're asking for random advice, and yet turn to your neighbor, turn to your friend, say, "I know that you went through this," and I think we have to share those experiences because we are stronger when we can share. Hey, I went through this difficult time. I went through menopause and this is what I discovered. My child needed a dermatologist and this was their experience. If we don't share those experiences, other people aren't going to learn from what we've been through. The best part is those providers that are here that can give us that professional, educated guidance
Yes,
is so important.
I agree with you completely. Um,
I love it. I love it. I mean, October 2nd
October 2nd.
is the next girls' night out.
Yes.
But really, I will tell you in the mammography department, it feels like girls' night day or girls' day in every day.
Every day.
And so whether you're able to attend girls' night out on October 2nd, 6 to 8,
It'll be
6:30.
6 to 8:30, and so I have Rebecca Cressman coming in. She's a news anchor for FM 100 and KSL, and she's breast cancer survivor, and that's what this really started out as. In 2012, Mary Piscitelli was one of our keynote speakers, and she shared with us her experience with breast cancer. And actually, there's a video on it, and she she's a dear friend of mine, but she said that one day she was cooking, and her husband Bob came up behind her and hugged her, and her chest hurt, and then she found the lump through a hug, and so she came in and she found it, and we asked her to share that journey because so often as women, we put our health on the back burner. And you remember what it was like when you had all the kids in school and you were still trying to work or serve the community or serve in a religious calling and show up for school and help with homework and coach the soccer team and help your husband and all the things. We women, we tend to put our needs to the back burner, and I don't think that's like intentional or self-depreciating. I just think it's what happened.
Right.
Someone calls and needs something and we run and do it. And so that's really how it kind of started.
Love it. But it is that reminder. It's that take your health serious and make it a priority.
Yeah, completely. And so then Rebecca Cressman will speak. And then we added a couple of years ago a service project just because I felt like what a better opportunity than for us to get together and do something that we can give back to others. So this year, we have seen a big increase in high acuity pediatric patients coming into the emergency department um, for various situations. And so I have all the stuffed animals, and then you stuff them. It's like a Build-A-Bear,
Yeah.
a portable Build-A-Bear component. You write a note to the child. We'll package them up in bags, and then we give them to those patients for coming into the emergency department.
I love that. I love that. My parents, we used to do blankets for Christmas and donate them to primary children's, and it does. It makes you feel like I'm making a difference in someone's life that could be going through something really hard.
Yeah.
So thank you for putting that together. This has been so great. I knew it was gonna get a little emotional because healthcare is emotional. It hits home and it hits families, so thank you for the work that you've done. As we wrap up, I'm just curious, Amy, why do you serve? Why do you serve this community the way that you do?
Well, like you said, healthcare is such a sweet spot to be in. I'm not clinical, but I do get to witness those sacred moments. I remember years ago when I first came back to work, I was having a discussion with Dr. Hatterley, and he had just done some amazing things with one of his patients. And the nurses had actually called me, Amy, you need to get over here. Dr. Hatterley is caring for this patient. And they kind of gave me the story. And I'm like, perfect. I'm free. I'll come over right now and get pictures and tell the story. And Dr. Hatterley was kind of being adamant that we were not going to tell this story. And as as he and I were having the discussion in the corner of the med surg area of the hospital, he said, Amy, these are sacred moments for this patient. And this patient happened to be passing away. And he said, and for me, I've come to love my patients and I don't want to make light of something so sacred. And that has always stuck with me. Um, I'm not clinical, but I get to witness this team at Heber Valley Hospital doing incredible things for the community, for their patients, and I'm honored that they'll let me be a fly on the wall in the care that they're providing and then helping them tell their story because it's a beautiful place to be.
Oh, wow. I love it. You're a beautiful person. Thank you. Thank you. You are too. So this is Rachel Kaler. It's been such a really emotional and heartwarming opportunity to sit down with Amy Tuddenham with Heber Valley Hospital, and just thank you for what you do and for being a community worker.